I know some people might worry that, getting permanent teeth the day after surgery, oh my goodness, is that going to be painful?
I had seen I can have my permanent smile in 24 hours. I'm like going, how is this going to be done with every other company I've met for 2 years kept on telling me 8 months to a year. This can't be true.
How did you feel when you actually saw your new smile in the mirror for the first time?
It was shocking. I was afraid to smile at first because I'm like, what's it going to look like?
What was it like eating that first bite of food?
It was one of those things that I didn't think was ever going to happen. And I bit down and I heard the crunch. I jumped up and went to the bathroom in the restaurant.
Today, Trish is here to share what recovery and maintenance are really like after getting her 24-hour permanent smile, from her first night after surgery to those first few weeks, and what life looks like 3 years later. You ready, Trish?
Sure am. Let's go.
Before we get into recovery, we have to first talk about surgery, right? So, what was it actually like to be in the chair that day? Were you put to sleep? What did that look like?
I was very happy to be put to sleep because if you think about it, this is a major surgery. Most of us have gone through cavities, root canals, where they just give you that local shot. Keyword local. So when they said, yes, you're going to be put under, you're going to have the best nap of your life. I'm like, let's do it. It's going to allow them to be able to do everything that they need to do, from the extractions, being able to put in the anchors in your upper and lower jaw. And then when you wake up, you don't remember anything. So when you're in that chair, they're all like, okay, count to 10. I think I got to 3. And that's what they told me. They said, you passed out so fast. And honestly, they had to wake me up because I was done with the procedure. They're like, okay, it's time for you to start waking up. And I don't remember. It was like 4.5, 5 hours later from the time I sat in the chair to the time I was done and I was ready to be rolled out to the family members that were picking me up.
Wow. So who was all involved, like, in the room with you there? Like, what did that look like?
So you had your surgeon, you had the individual that makes you happy and lets you go to sleep. They had the surgeon assistants. And then also you have your restorative doctor who basically is the one that makes sure that the measurements, make sure everything is set for your new smile the following day, because nobody is the same. So it's not a one size fits all. It's not like, here, oh, you look like a size medium. Oh, no, you're a size small. No, I have a very small mouth. So yes, I'm very happy that they measured everything, because if they put something in too large, it wouldn't look natural to me. And that's
Right.
something that other locations were not doing. They're all like, this is what you're going to receive. And that's something that was very important to me because I wanted to be me. I wanted to
Mhm.
look like me. So I wanted to have that opportunity. So that restorative doctor met with me during your smile consultation. They met with me before surgery. Saw them afterward, but they were there and they said everything went well. So you have a lot of people in the room. So it's just not one person doing everything.
And how did that make you feel? Like, coming in maybe with this fear, how did that make you feel knowing that there was gonna be, a group of people working on you?
Knowing that you have that many people looking over you is huge. Because if you think about it, if you only had one person trying to do everything, how effective is that one person going to be?
Mhm.
And
Mhm.
I know before I had all this, when I would go in to the regular dentist and have a root canal, there's at least 2 people there. He was doing the numbing, my dentist would do the numbing, and then he would have his assistants giving him the tool or whatever he needed. So there was 2 of them. So knowing that this is a major surgery, knowing that I had 3, if not 4 people in a room at all times is incredible, because they're looking after you, because you are their number one. They want to make sure you're comfortable and that everybody has a specific job. Everybody has one specific goal. And like I said, is it the assistant? Is it the surgeon? Is it
Mhm.
just like I said, the person that puts us to sleep? They're making sure everything is going according to plan.
Absolutely. Wow, wow. Okay, well, take me back to that first night then, after surgery, you went home.
Mhm.
Was that like anything you had imagined? What were you experiencing during that time?
For me, I was not really, I know every patient is different. So I did not have the pain and everything that first night. It was discomfort more than anything else. Because if you think about it, your teeth were just extracted. You have the ice on your face. So I was provided a disposable ice pack that went from underneath my chin and above. Every I see different patients that get the ones that look like a full face mask. Some do just small ice packs. I bought a couple of smaller ones because I was alternating, so I was always getting ice on me, even during the night. So that night, I had like protein shakes. I had Jello. I had very simple things because I wanted to have something on my stomach because you don't want to keep going without anything. Because yes, I was provided if I needed something for pain, and then I was also given almost like a Tylenol if I just needed something to take off the edge. But that first night, yes, you're sleeping sitting up. That's something that they suggest because surgery, you don't want to be laying down for that healing process. So I was up in a recliner, no big deal. And like I said, it was more discomfort, but it wasn't excruciating pain. I had been in more pain with my original teeth than after this surgery.
Wow. That says a lot.
It does.
So at this point, you don't have your teeth in your mouth, but you have your implants that replace, right?
Correct.
So let's talk about the next day then.
Okay.
I know some people might worry that, getting permanent teeth the day after surgery, oh my goodness, is that going to be painful? So, what did it feel like to get those teeth placed the very next day?
That's something that I was thinking about. I'm like, okay, my my jaw, I had the stitches, I had all that other stuff. So they had those little caps over where each one of the, as I call them, anchors were. So when I got in there, they said, okay, this is going to be something that's going to feel a little bit different because you're going from your natural teeth. Last night you had nothing. Now we're going to give you your full arches. So they went ahead and placed them. They tightened them. So as we go through, we know that we've got this 4 months of the healing process. So they went ahead and tightened them. And it, like I said earlier, it was more of a pressure. I
Wow.
was
Okay.
not in super pain. I just took a normal Tylenol. I just did it for me, just in case my jaw was going to be sore. I did it for a preventative. Did they tell me I needed to do it? No. I've just had so many different medical procedures. I know sometimes my body, I need just something in it before a procedure is done, if I can do that. So that's what I did. So when they went ahead and put it in, they tightened everything and they did made sure everything fit properly. They made sure that when I bit down, that all my teeth were in alignment. They made sure that nothing was off from when they did the molding, and made sure that, like I said, everything is custom to you.
So, what was the strangest part about having your permanent teeth that next day, though? Did they feel weird? What did it feel like?
What felt weird to me is that I had so many missing teeth, my tongue didn't know what to do. And I know it sounds weird, but my tongue was like going around behind my teeth going, "Wait, there's all your these teeth. There's not a hole missing. There's no." So my tongue was doing a little bit more exploring than my brain, because it's a brain setup. I think of it more of a, you have to retrain your brain more than anything else. It felt incredible that I did not have to chew on one side of my mouth. Mentally, I was like, "Oh my goodness, I can actually chew on both sides of my mouth when I'm ready. I don't have to just chew on my left side because I had more teeth on my left side than I did my right side." And that's something that I had to train my brain during this entire healing process. It is okay to chew on the other side. It will be okay. But it's just the smaller baby steps that you have to take because this is so new to everybody.
Totally. That makes a lot of sense. It's a foreign object in your
Yeah.
mouth, so that sounds about right. What about, how did you feel when you actually saw your new smile in the mirror for the first time? Was it weird? Did you recognize yourself? What was that?
It was shocking because it had been, I don't even know how many years since I had a full set of teeth, because every time I smiled, it was like this. I didn't show anything. So when I flipped it, I was afraid to smile at first because I'm like, what's it going to look like? Because I've not seen myself in a large smile for years. And I just stared at myself because I did the reveal by myself. Nobody was there. So the only person that was there was myself and the Phoenix team, because I did everything on my own. I wanted to make sure everything was me, even though my parents and my family said, "We'll go with you." I'm like, "No, I'll just do this on my own." So I flipped the mirror and I just stared at myself. It seemed like it was 5 minutes, but it was maybe 20 seconds. And they're like, "Are you going to smile?" And I said, "I'm sort of scared to smile." And they're like, "Why?" And I go, because I'm not seeing myself in all of these years with a smile. I didn't even smile in my wedding pictures. I do not have one of my wedding pictures smiling. It was always a half smile. So when I did that, I just, of course, started crying and what have you, but everything's happy tears because I'm like, this is a new chapter in my life. I'm actually going to be able to do things. I'm actually going to be in front of a camera. I can take pictures. I don't have to be the one that's going to volunteer to take the pictures. I can actually be in the
Mhm.
picture and be happy about
Mhm.
it.
Yes, you deserve to be in those pictures, and I'm so glad, you know, you had this moment. Like, I can imagine how scary it was for you, though, because, like you said, you didn't smile in your wedding photos. Oh my goodness. Like, this is a huge thing, and I kinda wanna ask you this too. Why did you decide to go to a place that did permanent teeth in 24 hours versus maybe the traditional way that's been done for so many years? Like, why choose this place?
I've said this many, many times. I spent 2 years researching. So when I started the research, it was COVID. I was excited to be behind a mask. Everybody hated the mask. I loved the mask because I was getting judged all the time. So I was talking to people nationally, locally, regular dentists, periodontists, oral surgeons, you name it. And everybody I talked to that said, okay, if you're going to do a full mouth, full dental implants, you're going to get your teeth done. You're going to be in a healing arch for anywhere from 8 to 12 months.
Oh.
I'm like, 8 to 12 months? I'm like, I've already lost 30 years of my life because of not being able to smile. And you want me to go another 8 to 12 months before I'm happy? I'm like, No." And Nuvia was the last company that I met with. I'm like, okay, after I do this consultation, I do this meeting, see if I'm even a candidate, what's going on. This is the last one I'm going to do. And because I had seen I can have my permanent smile in 24 hours, I'm like going, how is this going to be done with every other company I've met for 2 years kept on telling me 8 months to a year. So
Right.
going in, I was like, how this can't be true. Is that one of those things that is too good to be true? And that's what I was thinking. But as soon as I went in and met with the team and saw what they had developed and saw people that were having the same issues as I was and how happy they become and what Nubia did for them, I'm like, okay, if they could do it, can they help me?
Right. Wow. 8 to 12 months, that sounds like I'm good,
Yeah.
Like, oh my goodness, that makes sense. And you kind of took the leap and here you are today, and I think that's pretty awesome. Well, before we move on, Trish, if someone's watching and wondering, whether they could even be a candidate for the 24-hour process, where should they start?
What I did is I filled out the 60-second quiz because from there you can see if you're going to be a candidate and then set up that consultation because if you don't do it, you'll never know what that permanent answer can be. If you don't do it, it will always be no. Like you said, take that leap of faith. That's what I did. And here I am, so much happier than I was years ago.
I love that. And where can people find that quiz?
Right below.
Awesome. Well, now that you've got your teeth in,
Mhm.
what about these next few days and weeks? What did that look like? Were you still having this discomfort? Um, what did you feel like?
Some people bruise, some people swell. I did not have any bruising. I took it. I was a athlete from the age of 8 years old. I played volleyball, softball, basketball, competitive baton twirler. So
I
I
love
got injured a lot. One of my one of my trainers, he's always like, you need to have a ice pack in every single bag of yours because you're going to get hurt. My senior year in high school, I caught myself on fire, trolling fire in high school. That's another story. But
Yes, it
yeah,
is.
so I knew I needed to be using ice. Ice is your friend. Ice is your best friend for these couple of days. So even though I had gotten my permanent smile that next day, I still iced. I did for a couple of days because I wanted to make sure I could keep the swelling down as much as possible. If I was swollen, I probably couldn't tell because I have chubby cheeks. As you can tell, I got chubby cheeks. So if I was swollen, I may not have seen it, but I did not do that. But I took it slowly because I did not want to mess anything up. So the first couple of days, like I said, I was doing protein shakes. I was bad the first day. I had a milkshake. I had a protein shake. Anything that I should not have had, being a type 2 diabetic, I did. But I had already talked to my doctors, letting them know what I was doing. So they were okay that I was going to have a couple of off days because I knew that I would get back on track. So as I went through, I went ahead and made sure I was getting the food that I needed. So I started introducing scrambled eggs, yogurts, and your body knows what can happen. Then I had soups. I had chicken noodle soups because if something has fallen, top ramen. So yes, that first week is that learning curve because it was still discomfort. There was not the pain. And some people are like, I don't know if I can bite down. That's why if you do a pasta, if you do a chicken noodle soup or whatever it is, those noodles are so soft. That's something that you can do to start learning that you can start biting down because it is plastic fork friendly. You can cut a pasta, a scrambled egg with that plastic fork and you are fine.
So you're saying you don't have to be on liquids. Wait, it's a soft diet?
It's a soft diet. So that was some of the companies would tell me that you're going to have to be on a liquid diet. And I'm like, why a liquid diet? They're like, you need to heal for this many months. And I heard all kinds of different time frames. They're like, you need to be on a liquid diet. And I go, how am I going to get my nutrition? So when Nuvia told me plastic fork friendly, I was like, okay, that's a new terminology that I have not heard before. I'm like, please explain. They're like, anything that you can cut with a plastic fork, you can eat.
Wow.
So in those first couple of weeks, I started introducing fish, scallops. Our family loves chicken. So I put chicken in my Instapot and I shredded it. And
Ooh.
then you can utilize that. There's your protein. You can eat I was eating chicken by itself and it to be cut with a plastic fork. And I was perfectly fine. So you start learning that no, this is not a liquid diet. You just have to be conscious of what you can do and what you can eat. And I always say, take a cheap plastic fork. If you can go through a cheap plastic fork, those heavier duty ones, you'll be fine.
Well, that is great news. That is great news to hear. I do have to ask you though, what was it like eating that first bite of food? What did that feel like?
It was one of those things that I didn't think was ever going to happen because I was so used to learning how to cut things in small pieces and swallowing and not really chewing. And they always tell you you need to chew your food to get that nutrition and everything. I was learning just to put it in and swallow, put it in and swallow. So when I had that first, I had salmon. I had cooked it. We had salmon and everything. And I put it in and I bit down on it. I'm like, I haven't had salmon. And it was like I won't say a new texture, but the taste was so different because previously salmon slid right down. So I was not taking in that taste. So I would always cook salmon for the family, all different flavors and what have you. But now it was my turn to finally bite into something that I had missed. And this was something that I had not had in I don't know how many years to count.
Wow. Wow. That is so I can only imagine, like, what that feeling is like, you know? Well, during this time too, these first few days, first few weeks, what does someone have to know about keeping them clean? Were you worried about, what to do during this time, or how did
Yeah.
that go?
So the office gives you a mouthwash. So they tell you to use it like a day or two before to start getting prepped. So during that 2 weeks, you utilize that. You're going to get things underneath your arches. You are healing. Things are swollen. They give you like a little syringe where you can take it and push water underneath your arches. Then you can get out any remnants or what have you. Personally, I use that, or I would take just a couple of drinks of water, swish it around, and rinse out my mouth that way. Because during these first 2 weeks, you're not going to utilize your water pick. You're not utilizing any of the things that you will be cleared for, if you want to call it, at that 2 week mark. So those first 2 weeks is the syringe, just rinsing out your mouth, just swishing it, and you start learning that you'll start brushing your teeth. You want to make sure that you're
Mm,
utilizing a soft toothbrush.
totally. That makes sense. Well, did you have stitches after surgery? You did mention stitches
Yes.
after surgery.
Yes.
So, what was that like? Were they painful? Did you notice them much? Are they supposed to dissolve? What is that?
Mine did dissolve. There was 1 or 2 of them that just did not wanna dissolve quick enough, but the other ones would dissolve. So sometimes I would feel like the end of the stitch that was poking from underneath the arch. They said that was normal because as soon as I felt it, I called the office. I'm like, "Did I do something wrong?" And they said, "That's perfectly normal because your mouth is healing." So the stitches can shift a little bit. So when I went in for my 2 weeks, they looked at everything and they went ahead and removed the one stubborn stitch that did not want to dissolve. And that's all they did
Interesting.
is that they went ahead and just made one little snip and they pulled it out and it was one little piece. The rest of it had dissolved. There was one little one that was holding on for the last leg. It was not going to give up. It's not, I'm not going to dissolve. I'm going to hold on. But no, all of mine dissolved within about that 2 week mark, at about 10 to 12 days. And I saw them obviously about 14 days.
Okay, nice. And, was it like when they were in,
Mhm.
did it feel uncomfortable or did you even notice them much?
I really didn't notice them because it was underneath your arches because it's gonna be on that on the jawline, on the gum, and then
Mm,
you have your gum here, and then you have your arch on top, so it was closing up the openings of where you did not have your anchors. So, yes, your gums are swollen when you first get done with your surgery, and they start decreasing because that swelling is going down. So, anybody that may have that pressure like I did, like I mentioned earlier, it starts decreasing because those gums are starting to lose that swelling, and that's telling you, yes, your gums are or your gums are healing. Some go quickly, some go take a little bit longer, but your body heals differently. That's the biggest thing that I
mm.
tell other patients that ask me this. Not everybody has the exact same recovery. Not everybody's gonna recover the same. So what happens to me, if it doesn't happen to you, you're not doing anything wrong. Your body heals differently.
I think that's great. That's great advice because 'cause you're right. We're not all the same.
No.
It's not gonna look like cookie cutter. So, during this recovery period, if you had any questions or concerns or you're worried
Mhm.
about something going on, how are those addressed?
What I loved is that during the smile consultation, while we were finishing everything up, they made sure if I had any questions or concerns to contact the office. They even mentioned this to me before I went to sleep before the surgery. They said, "Remember, we're here as a team. We are here to support you. So if you've got questions, you have concerns, call us because you are our patient and we're here to make sure everything goes according to plan."
Well, that would definitely give me peace of mind.
Uh-huh.
So you don't have to wait till the 2-week appointment to get your questions
Well,
answered. Is there a follow-up after that? I think you mentioned, like, 4 months.
correct.
Is is that the next appointment that happens?
Correct. So you have your 2 weeks, and then everybody looks forward to that 4 month appointment. That's sort of where you get to be released to have anything and everything that you have not been able to put on your plate to eat. If it's crunchy, is it sour, is it Mexican food, whatever it is, everybody has in your mind what is going to be that first meal that you're going to eat. And I love hearing everybody's perspective of what their meal was. I've seen steak, I've seen Mexican food. I've probably the one that surprises me the most that everybody wants to go to a salad. They've not had a crunchy salad, so they go for a salad. But I always like hearing what everybody wants to eat at their 4 month.
So, before you mentioned, when you first took that bite, you're kinda going slow with it. What was it like for you eating this harder food? How did that go?
I was scared at first, not gonna lie. Because even though they said, yes, you can now have anything, you've been cleared, everything is healed properly. It's now time that you can enjoy life. You can now go eat. That I love Mexican food. I'm out here in the Southwest. Mexican food, chips and salsa, that's that's in my blood. That's just me. So I got a chimichanga, I got chips and salsa, all the stuff that I hadn't had for all this time. And the first time I cut into my chimichanga and I bit down and I heard the crunch. In my mind, before I had my implants, a crunch was bad. A crunch meant a broken tooth. A crunch could have been a tooth falling out that you had just cracked. So that sound that went into my head, I jumped up and I ran to the bath because we were at a restaurant. I jumped up and went to the bathroom in the restaurant, and I'm opening up I'm looking, I'm like, "Okay, did I break something?" And I came back to the table and the family's like, "What's wrong?" I go, "I heard a crunch." They're like, "Yeah, you bit into a chimichanga." I'm like, "No." I go, "This is a crunch that's usually a bad crunch." And
Wow.
my parents are all like, "Okay, is there anything wrong?" And I go, "No, I think it's been in my head so long, when you hear
Mhm.
that crack, that crunch, you know something happened."
Mm.
So
Right.
that first meal, did I enjoy it as much as I wanted to? Maybe not, because I just kept on double guessing, even though, like I said, I got the green light. There should have been nothing, but this up here was stopping me at first.
Uh-huh.
And so I took half of it at home. I just had a couple of chips. I waited a couple days, so I went back to my sort of my friendly, soft plastic fork, and I was eating chicken. I was eating salmon like I normally would do, because I mentally had to get prepared again. And I know people are going
Mm.
to laugh at this, saying, "Well, you got the green light. Why didn't you just do it?" It was a mental thing for me. It truly was.
That makes sense, though. I mean, it's been so long to where you were able to eat this food and you wanna be careful about this investment that you just made, like, I think feel like a lot of people would probably feel that way, so I don't think you're alone in that, but I do have to ask, it's been 3 years,
Mhm.
right? It's been almost 3 years.
Almost 3
What
years.
is it like chewing and biting things now? Like, is it still weird? Can you do it? What's going on?
There's no hesitation. It
Oh.
is it is so crazy, because I never would eat anything sticky. I would never eat anything. You see the caramel apples in the fall. I had not had one in 30 plus years. Things that any type of candy, anything that was sticky, gooey, what have you, that was always off the table. Here I am, October will be 3 years, and I can't believe it's already been 3 years. I'm like, where did the time go? But I can put anything on the plate, and I can have it and not have that hesitation. And about a year and a half ago, I got the old fashioned taffy, the stuff that would have been completely off the table. And my friend's like, "Are you going to try it? Are you going to try it?" I'm like, "Yeah." And he goes, "You're crazy." I'm like, "Why?" And he goes, "You have not wanted to do this. You've not wanted to do." And it was just a saltwater taffy. Nothing exciting. I bit straight through it, and it felt so good because I pulled it, and it was that string.
Yeah.
And I'm just
Oh, yeah.
and I'm like, "Okay." And it's incredible what you can do. And something else that my family has laughed about, especially my daughter, is that when you bite down into a sandwich, if it's a regular sandwich, is it a sub sandwich, what have you, I never could bite all the way down and leave where I took a bite. So the first time that that happened, I was like doing a little bit of a happy dance, because I could bite through the entire sub with the meat and the lettuce and the tomatoes and all of the condiments on there. I bit straight through, and it wasn't like I was pulling it and the meat was coming out with it. I bit through everything, and you could see exactly where I took a bite. Little things like
Wow.
that is huge, because, like I said, I don't remember the last time I could have done that, because you've not had that in your life. You've not been able to do something that simple, and other people, they're all like, "Well, I've been able to bite through a sandwich my entire life. Why are you so excited?" Well, you've not gone through what we've had to go through. And if you've not walked in our shoes, you don't understand our happiness on the other end.
Totally. And I think it's those little wins that the fact that you're acknowledging those little wins, I think is a big thing too. Like, you're not taking them for granted. You're like, I think that is super, super awesome.
You
It is the little things.
you
That's
can't.
what life is, right?
That's why I say
Yeah.
you have to take your little wins.
Mhm.
That's
Exactly.
how I
Totally.
took it through this entire process, from the consultation to my 4 months to all the way to 3 years, is that if you don't take the baby wins, even in regular life, it's not a progression. So every little win I could take when I was healing, it was even a baby step. It was a giant leap for me because people
Right.
don't realize what Nuvia has done for me and thousands of other patients. They have changed our lives more than we can ever say thank you.
That is incredible. I'm so happy you are where you are today, Trish. It fills my heart with joy. I do wanna bring it back to before when you after you got your teeth in, you said you kinda had to be careful and cleaning, you had a syringe. So 3 years later, what does taking care of your teeth actually look like day to day now? Does it feel much different than your natural teeth, or is it kind of hard to maintain?
It's not hard to maintain at all. So I have my water pick. I have one for my house. And then when I travel, I have a smaller one. It's a little one about this big, but it fits in the palm of my hand. So I always have my water pick with me. If I go to a restaurant and obviously I don't have a water pick with me, I can take a little sip of a water, swish around if I had to, if something was bothering me. But I use the water pick in the morning. I brush my teeth, you floss, and then same thing in the evening. So what's nice is that when you're cleaning your teeth, you're hitting so many different aspects. You're not going to worry about is when you brush that tooth, is it going to break off? No, you're not going to have that anymore. You're not in pain. So, yes, the first couple of times, yeah, it took a while to figure out the flossing. Is flossing the easiest thing to do for people? No, but there's things that the offices can show you. They can give you different tricks, and that's how I was able to floss. But I use my water pick quite a bit, and people say it's challenging to use a water pick, but one of the tricks that I always tell people is start with the water pick in your mouth before you turn it on. Too many people turn it on and then try to put it in their mouth, and then they want to know why themselves and their mirrors are wet. Start in the mouth, then turn it on.
I think that's great advice. Well, it sounds simple enough. It sounds simple enough. Taking care of these teeth, I feel like I would expect, oh no, it's going to take all this work and maintenance, but it sounds like it really is not really much something you think about too much anymore.
No,
So I think that's pretty great. I do want to ask you, what fears do you think are stopping people from getting something like this done?
what I'm thinking is probably what I went through, being told that this may not be a possibility for you. If you don't go for the consultation, it will always be a no. Go for that consultation. They're not going to judge you. That was something else that was a fear of mine because I was being judged everywhere I would go. I heard a couple of offices talk behind my back about what I look like and my teeth. And unfortunately, mine was medical. Mine has been hereditary. It's not that I never took care of my teeth. I was every 6 months when I was a young girl growing up, I was getting my checkups. I was going to the dentist. I was doing everything that they told me to do, but I was still having issues. So I've struggled my entire life. So when you go as an adult and you have all that, I don't say resentment, but all of those feelings coming back,
Hmm.
I was like, I don't want to go because I don't want to be judged. I don't want this. So a lot of people have that fear.
Hmm.
So as you go through, that office is there to help you. They are there because they know that we are struggling. They want us to be a better person. So if they are there and they can help you, let them because they become your second family. They truly do because they care that much about patients.
And what would you tell someone who's most fearful about this surgery and recovery process that we talked about today? What would you tell them?
It's not as bad as what you're going to think because I know that people hear the word surgery. They hear, oh my goodness, it's going to take forever to recover. Yes, you may have had a knee surgery. You had this surgery, that surgery. Yeah, those surgeries can take forever because you have to go to physical therapy. Our physical therapy for our teeth is talking. If you have a little bit of a lisp, do tongue twisters, sing in the car, sing in the shower, because the more you talk, the easier it is. Fears are going to be there. The unknown. When you hear that 24 hours, it's like, is it truly going to happen? But look at how many patients are on the other side that are after their 4 months, 1 year, 2 year, 3 year, 4 year patients plus, and look how well Nuvia has helped us transition. And I have had so many incredible opportunities. I met so many people within Nuvia just as sharing our stories with each other, because everybody has a different path. Let us be part of that path.
That is like such an amazing way to look at life. And Trish, I just got to say thank you so much for joining us today, giving us insight on what people can expect when getting this procedure done. Um, and again, you mentioned earlier that people can find out if they could be a candidate if they take that 60-second quiz in the description below.
Yes.
That is a great place to start. So
Yes.
thank you, Trish. Thanks for being here.
You're very welcome.
And for those watching, until next time.
Keep smiling.